Hello, it's Kevin here. We're going to have a look at a letter. Just put this up first. Usual disclaimer, blah, 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 blah. You know the score, fair use teaching, etc. Okay, so, Mrs. Maria Santini. Okay, let's have a look at the notes. And we've got the criteria, again, fair use, etc. So, what are we doing? Okay, so, as always, go to the task first. So, referral to the orthopaedic surgeon. Then go to the plan, diagnosis and assessment. So, this is a bit that concerns me. Assessment and management and a possible steroid injection, joint steroid injection. Okay. So, the diagnosis: Baker's cyst, worsening osteoarthritis, chronic significant pain, reduction in activities of daily living and signs of depression. Okay, pretty straightforward there it seems. So we've got one visit, I think. So we don't really need most of this stuff. I mean, lives alone at home, confined to it. Now this is not strictly speaking going to affect how I would treat the patient, but still, you could put this information in to explain the state of mind of the patient, maybe. So, alone, reduced activities of daily life, stopped accessing the shops and friends, two-story house, depressive symptoms because they're not meeting people, etc. So, let's just go back and, So, as part of a plan, refer to physio to improve joint mobility, and maybe get a district nurse to go and give a living at home assessment. Now, why would they do that? Because the pain and the mobility restrictions has stopped her accessing the shops and friends and etc., which in turn has caused the symptoms of depression. Okay, seems pretty straightforward. So, book changes. Right. I'm writing to refer Mrs. Santini. Signs and symptoms are suggestive. You could put that, but usually you put suggestive when you want a definitive diagnosis. And here, I think the diagnosis is pretty clear, I think. Yeah, it's not a tentative, it's not a provisional, it's pretty clear. So you usually put suggestive of, when you're not sure. What you could maybe do is put indicative of. You could do that, so that's a little better than suggestive. If you want to do it like that, so you could maybe do it like that. Indicative of, or simply who has a right knee Baker's cyst and worsening osteoarthritis. You could do it like that if you want. So if you want to do suggestive, it's not really, because you that is your diagnosis. You don't want that confirming. Or you can simply say who has a right knee Baker's cyst and worsening osteoarthritis. You could do either one of those. Okay. So, history paragraph, condition, right, present perfect, has had. Since 2003, you've got your adverb since, so present perfect. In addition, should not in respectively. Okay, that's pretty clear. That's good. So, on the 17th, is 17th entered with a 6 weeks, with a 6 week history of. So usually progressive pain in the knee joints, especially on flexion and extension. Now, I was going to just have a quick look. I think you need to be careful here, because this is pretty close to the case notes word for word. It's nearly word for word the same, and we don't want to do that. If it were a simple matter of copy and pasting, then this wouldn't be a proper test, really. If you copied and pasted and maybe changed a little the case notes, which is what you're not supposed to do. So I would avoid lifting words directly from the case notes, as in word for word. I would try to avoid that if possible. In addition, she's on the back of the right knee, but that's been for 4 weeks. So, put the time in, it's been 4 weeks, blah, blah, blah. In the same way that you put 6 weeks of the pain, how long has she had the lump? Is that 6 weeks also? Well, the case notes say 4. Restricted joint mobility, accompanied with a mild to moderate pain. So, that's pretty much the same wording as the case notes, so, okay. Now, this is not quite the same thing right now. So, first, it's been worded, have increased. Well, firstly, you haven't mentioned her depressive symptoms before, so I've no idea what you're talking about. Her depression symptoms have increased. Increased from what to what? What does that even mean? You haven't said anything here that she had any symptoms. So how do I know what those are and why or where or how they have increased? This seems to just come out of nowhere. And a decrease in her daily activities has been noticed. Why is it passive? Present perfect. Passive. Has been noticed by whom? So if we go to the notes, and I think you've got this the wrong way around. If you go to the case notes, so the symptoms have come as a consequence of her reduced ability to get around, which in turn has come as a consequence of the lump and the pain. So it's not depressive, she's depressive and that's come out of nowhere. This has come as a result of this, which has come as a result of this. So that's not being made clear in this particular story, because that's what you are doing, as I keep saying. You are telling me to read a story. You're creating a narrative, usually a chronological. So, right, we've got the purpose. That could be reworded a bit, but that's relatively clear. History, paragraph 2, okay, has had it since 2003. So what's the presenting complaint? Because it's only a single visit. So, 6-week history of pain in the knee joints, on flexion and extension. A soft lump, Baker's cyst. How long for? We don't know. So she has those two symptoms, examination, the crepitus in both knee joints. Where is it mentioned that? Yes, concomitant, crepitus, flexion and extension. You're just simply copying and pasting. Do you not think the examiners will not notice this? That you're simply writing it word for word from the notes. You're supposed to paraphrase. Otherwise, how is it an English exam, a kind of test, if you're simply copying and pasting word for word? So, one thing that's not worded particularly well, and two, I wouldn't have put it there in any case. And it seems to have come out of kind of nowhere. So I would maybe move that. We'll talk about that in a minute on examination. Okay. Should be advised. Should be advised? Why are you using a modal verb? Why is it passive? Should be advised. Who's going to do this? So, you want me to assess her and manage her and consider the possibility of a joint steroid injection. So maybe I'll advise her to have it, but would I really advise her, or simply say the treatment is, and do it in any case? Maybe I would. It's just the wording of this here. And to live at a home assessment. How can you live at a home assessment? What the case notes say as part of a management plan. So the first part is writing to me, the surgeon. Dear Dr. Kev, can you assess and manage this patient and possibly see about giving her an injection? For your information, the other components of the management plan are send a district nurse, maybe, to give her a living at home assessment. In other words, to assess what is going on in her house. Because here, she's got a 2-story house, but she can't walk. She can't climb the stairs. So the ADL here. So this causes this, which in turn is causing this. Okay, so you kind of wrote it the wrong way around. So the living at home assessment by the nurse would presumably be to see how suitable it would be to stay in her house. Maybe to move her to a bungalow with no stairs, or maybe to, I don't know, put a stair lift in, or put some, of those devices like in the bathroom and the shower, all those kind of things. Maybe. But I think that's what it's talking about, yeah? So this kind of here, and to live at a home assessment. So should be advised to take a steroid injection and to also take or have a live at home assessment. Is that it? Is that what you mean? That's not very clear. Physiotherapy is needed in view of the above, your assessment and treatment. So there's no mention of the injection. I mean, there's like here, should be advised. Well, who do you want me to advise her? Don't you want me to take a look at her first and see if that would actually work? Because I think it says, well, a possibility of. So it's possible. You want me to assess her and manage her and see about the possibility of the injection. You didn't mention that in the purpose. Okay, so the assessment and management, nothing about possible injection there. But if you don't put it there, you should put it in the closing where you are supposed to, purpose, restate it. Let me get my pen. Clearly expanded on later, often near the end of the document. So, quick and precise sense. Can you do this? Can you do that? I mean, at the end, in view of the above, would appreciate your assessment and treatment along with a possible, So, I would have probably put something here about a plan. Please note. So, the purpose, you want me to assess and treat her and possibly give her an injection. So that should be a separate thing. Now, the rest of the plan is nothing to do with me, but it would fill the story out, right? And it might give me some insight into her state of mind. Maybe. So you could have probably put something about the ADLs, the nurse. Please note a nursing visit will be arranged to assess, so I would have put something about, why the symptoms have increased. So first, introduce it. Why is she feeling this way? Because ADL. So you only mentioned that. Okay, so restricted joints. So it's not of major importance to the surgeon, but it could be useful information to help me, get into the mind or to empathize with my patient, all right, and to understand what is going on. Because what you want me to do is part of your plan. It's not the complete plan. There's other components, right? So you could maybe mention that, right? So put something about, where's my cursor? So this is just to give you some ideas per or the management plan, as well as your assessment. Please note, a physio, living at home, assessments, blah blah blah, be carried out, and blah blah blah. So you could do something such as that, because it's of secondary importance. So you can put it lower down in the letter. Purpose comes first. History, what happened on the visit, what she said, what you found, and then what you want me to do, and the management plan, secondary importance to me, the surgeon, but still I would include it. And you want me to look into the possibility of, and so you could rearrange all this to make it more, to give it a more logical outline, so it's like things aren't just seemingly appearing out of nowhere. Depression, who said that she was? What symptoms? How? Why? Who has kind of noticed it? So that sentence doesn't really work there, because it's leaving me, the reader, asking questions. And as I keep saying, right, if I've got to ask questions, then it hasn't worked. It's not logical. It's not clear as it could be. So as long as you've got the purpose, get the content, no details kind of missing. There's some stuff there that's kind of missing. It's like, I'm not sure of the whole story here, because you haven't said. How well is it presented? Is it as clear as it could be? Well, it's not really, is it? Because I'm asking questions, and if I'm asking questions, then it's not clear. It's just that simple. It's not a trick, is it? Right, so as I keep saying, right, every video, I keep on trying to make this point. The reader in real life will only have this document. That's it. They won't have the luxury, as I have had, of checking the case notes to find out what you're doing. So, if there's any questions here, if it's not clear to the reader, to me, to the examiner, it hasn't worked. And there's some elements here which are not clear. It's just that simple. So, precise, sense, okay. What do I need? It's been 4 weeks, what is it all kind of here? Now, usually, right, if it's not going to affect how I care for the patient, then I would say don't include it. But there's some stuff that's of secondary importance that may well, as in this case, I think, help me to understand the concerns of the patient. So when she comes to, and I assess her and manage her, I would keep this of secondary importance in mind. Yeah? So she's depressed. Why? Because she can't walk around. Why? Because of her pain in the leg. So I've got to, so it's all interconnected, secondary importance. So I might want to know that. It's not that vital, but I might think it's, it kind of works. So, concise and clear, is it clear? Well, it's not, is it? Because I've had to ask questions. And as I say, if I've got to ask questions, then it's not clear. Conciseness, okay. The genre and style, that's not too bad. Not too bad. Layout, is it clearly structured? Well, no. Is it organized and laid out well? No, it isn't. Again, why do I say this? Because I'm asking questions. If I'm asking you questions, or I'm asking questions of the document, then it's not worked. It has not worked. What is going on? Why do I have to ask this? So, what I would do then is reorganize this a little bit to make it as clear as it could be. Okay, so you have regarding her medical condition, so I'm writing to refer, that's clear. So this paragraph, it's a history. This is, because it's got a date, it's a visit. So restatement of purpose. So what about the management plan? Because what you want me to do is only one component of that plan. So maybe you should tell me the rest of it and spell it out exactly. Okay, so I hope that helps. Not too bad, but just a little bit of organization, I think, or reorganization, I should say, and this will be fine.